That's a lot of people. Thank you, Christine. Your compassion, your grace, and your leadership has meant a lot to me and our family in our first 10 months here in Wisconsin. So thank you so much. And Ken, Kelly, and Christine, it's awesome we could all be here together. So I'm grateful y'all are here today. I'm truly honored to share with you this afternoon, and I'm grateful for such a great turnout. And this, I promise, this is not a bear, all right? I love also why you are here this afternoon. Thank you for allowing me to talk with you for just a few minutes, maybe a little bit more. So I'm curious, what are you hoping for today? Any ideas? I mean, gifts? Anything? You're allowed to talk back. I'm actually Baptist, so I'm used to it. It's okay. It's okay. Or do you have any hopes today? All right. Well, I'll share with you my hope. I'm hoping to do a good job. Fair? Mostly, I'm still hoping to have a job after this speech. And I'm glad you're laughing. I was told it would be helpful if I shared a little bit about myself so you could get to know me a little bit. And so that's pretty easy. I'm Pam's husband. Thank you, Pam. Love you. So all the other acronyms and all that after the name, I prefer Jeromy. My mom gave it to me, and I like it. So please call me Jeromy. I joined the team last summer and began working as a chaplain a few weeks after I graduated seminary in 2003. And since then, I've worked in various civilian and military capacities. Over the last 2 decades, I have been blessed with opportunities beyond my wildest dreams all across the world. But the work I get to do at Rogers is truly one of the most impactful in my life. I get to do things at Rogers that is one of the most fulfilling things that I've ever done professionally. And I absolutely love coming to work. If you happen to work in the Laddish Center, I'm sure you know me because of my laugh. So why Rogers? Besides, of course, needing a job, because that's important, I wanted one that fit for all of our family's needs. And I was also drawn to Rogers because of their intentional investment in the greater good for everyone seeking mental health care, not just those who can afford it. Pam and I believe God led us to this place. One of our requirements as a couple was to go where it was cold and there would be lots of snow. I remember early last year sitting down as a family with one of those puzzle maps of the United States, right? Big pieces for each state. And allowed each one of us to pull out those states that we were not willing to go to, right? It was our way of establishing our non-negotiables. And so by the time it was all said and done, I had about 8 states I could choose from to apply for a job and hopefully our final move. We even applied for a job in Alaska, so you know we were serious about the cold thing, okay? But fortunately, we found Rogers, and I am so happy that we did. It has worked out very well for me and my family, and we are very proud to call Wisconsin home. So what do we do as chaplains? That's a question that we often get. What's a chaplain? Are you religious? Do you believe in God? And my personal favorite, what can you possibly do for me? Yeah, good question. I don't know. You tell me, right? But there are other questions. Questions that come up that are often unsaid but critical to our professional relationship. Questions like, can I trust you? Are you safe? Will you judge me? Is there any hope? And those are all really important questions. We have a list, as Christine shared, of several things that we do to support our patients and their treatment teams. The top two things on that list are spirituality discussion groups and individual consults. And I spend about an average of 85% of my day on those two job requirements: preparing for, providing, and documenting individual consults and group discussions. Our group sessions allow patients to discuss spiritual topics such as compassion and self-compassion, forgiveness, identity and self-respect, anger, hope, peace, and values, just to name a few. All groups begin with a slide about our expectations and boundaries for the discussion. And this slide came about last fall as we as a team, all four of us, were discussing a need to kind of say what the group was about. Because we were hearing from patients and staff that people may not go to group because they don't know what it is. They think it's a church service, or they think it's something faith-specific. So here are the 7 things we came up with as a team. This group supports your unique perspective and needs as part of your holistic treatment plan. This is not a worship service or Bible study or prayer group. It is about what spirituality means to you and how it helps your recovery. In this group, we speak for ourselves and not others. You may speak of your God, higher power, universal life force, Jesus, Allah, or other names as appropriate. Polytheistic and non-theistic names are welcomed and encouraged as well, as long as it helps you in your holistic treatment. We respect each other through our words and our actions, and all residents and patients are welcome to participate as you're willing and able. The feedback we've received from patients and staff after sharing these group expectations and boundaries has been overwhelmingly positive. Yeah. We begin these groups with open-ended questions, like, for example, when we're talking about labyrinth walking, where do you experience awe, mystery, and wonder? What comes to mind when you think of your own spiritual journey? Or discussing the topic of forgiveness, how many of you really want to talk about this topic today? What does forgiveness look like in your life? And sometimes we just ask general questions like, what does spirituality or faith mean to you? And what do you hope for? Have you thought more about that question since I mentioned it earlier? What do you hope for? It's a vital question for understanding our motivations as well as the motivations and needs of others. Our spirituality discussion groups often allow patients to check us out first before requesting a consult. They get to see for themselves if we're safe before including us in their treatment plan. And honestly, who can blame them? Who knows what their experience with religion or spirituality has been? Maybe their past experiences were not safe or healthy. Maybe those experiences contribute to their current struggles. Or perhaps maybe they're just curious about spirituality and willing to try anything if it can help. St. Francis prayed, "Lord, help me seek not so much to be understood as to understand." And that's what our team seeks to do, to understand. Knowing our patients' hopes, dreams, and expectations are foundational to well-defined treatment goals. It benefits our patients and those caring for them. Spiritual care at Rogers does not exist in a vacuum or in an island in and of itself. Every patient has a multidisciplinary treatment team comprised of a medical doctor, various types of therapists, nurses, and when requested, a chaplain. And that is unique in behavioral health care. We are an integral part of the team and are united through deep solidarity and compassion for others seeking help. As much as we'd like to, none of us have a magic pill for mental health needs. And we're not expected to do it alone. We need each other. Personally, I've always enjoyed working on multidisciplinary teams because we bring out the best in each other. And our treatment teams at Rogers value spiritual care. Behavioral health care involves treating internal injuries that are not easy to see or understand. Providing support can feel more tangible or attainable when there's a physical disability where we can see a need and possibly help out with it, right? But when it's invisible, those invisible wounds often generate a different kind of judgment or sense of isolation. As messengers of hope, our task is to attune ourselves to the needs of others, have compassion for them, and provide a safe and sacred space for healing. For the process to be successful, though, we need to ensure proper conditions for the wound to be exposed so that the healing process is not compromised. In our operating room, so to speak, patients are conscious and allow themselves to be vulnerable by sharing their unmet needs, fears, and longing for something different than what they've known to this point. So they choose to lay their souls out in the open, hoping beyond hope that something will change. Ann Voskamp says it best: shame dies when stories are told in safe spaces. Our job is to provide a safe space for our patients to face their reality. And in doing so, our presence reminds them that they are not alone and there is hope. One of my hopes is that each one of us will be filled with the life-giving, regenerating, co-creative spirit of the divine. And I see that happening when we live compassionately with ourselves and with others. So what does a spiritual encounter look like, right? I mean, sometimes we talk about the Odyssey, and other times we talk about the weather. And then other times we simply sit quietly and patiently with them without saying anything at all. Easy. There's really no checklist for spiritual care. I don't think any one of us would want that. It's about genuine, authentic relationships, because all of us long to be loved and valued as we are. I have two examples, but I'm not going to share anything that would identify a patient. And to be honest, I'm not sure if I can fully explain why these two consults were so impactful for the treatment teams and memorable for me, but I'm going to do my best and try. So the first example. This example on how trust and safety can heal us from the inside out. This occurred with a patient who had experienced an array of mental health diagnoses that others did not know about and could not see. This patient first requested a spiritual care I just remembered this person's face. This patient first requested a spiritual care consult because they wanted to practice their distinctive faith tradition while in treatment. Throughout our first 2 consultations, it was clear they did not trust many people, including their treatment team. There were a lot of misunderstandings and some intense conversations with others during their first few weeks in treatment. This patient was angry and relied on their weekly spiritual care consults throughout their treatment process as a reminder of why they chose to come to treatment in the first place. So, what did we do in those private consults? We established trust. And we developed a pastoral relationship that allowed this patient to talk more openly about their personal beliefs and their relationship with their God. What this patient had not done was tell God those exact same things. So we tried something new. This patient loved journaling but had not considered writing a letter to God about how they felt about Him. And I say Him because that's how this patient referred to their God. This patient was angry and expressing it in various ways, week in and week out. About a couple months into treatment, they agreed to write a letter to God. The following week, they read their letter out loud to me. And it was a moment of significant change for this patient, a pivot, if you will, a shift. They said, I kept asking God, why Wisconsin? But now I can see I would not have had this opportunity and made some of the discoveries had I not been here. Their anger towards God shifted from lament to praise, and this changed their outlook on their treatment team and how they communicated with them. They slowly began to work with their treatment team and actively participate in group activities. Their trajectory was shifting from despair and brokenness to wholeness and growth. Before their discharge, this patient was adamant that we meet one last time. During our final visit, they prayed out loud with me for the first time. And they prayed for all of the staff members that had been caring for them. And they expressed gratitude to God for leading them to this place. And friends, that was sacred ground. Communicating this patient's spiritual needs to the team was a process of informal discussions and then also the formal charting in the patient's medical records. But to be honest, I wasn't sure how my notes were received, and honestly, if it made any difference at all. It wasn't until I asked one of the therapists months after this patient was discharged, where did you see our impact in this patient's care? And she said, in this case, we served as an advocate for the patient. And as a result, they added in silent time as a behavioral activation for this patient to reflect spiritually. As a result of the holistic care and attention this patient received, they began to allow more members of the team into their treatment process. Trust was established and maintained. This patient expressed gratitude because they felt safe, heard, and understood. Another example is when a resident in a different unit requested a consult but did not hesitate to state her hesitation about visiting with me. She said, I don't believe in God, and I have a few questions you need to answer first before we meet. Like I said, easy. So she was honest, open, and had valid reasons for being guarded. It did not take long before I learned of the horrific ways she had been treated and assaulted within her religious experiences. We quickly identified that she reacted negatively every time she said or heard the word God. It was not at all helpful for her. Yet she still had this desire to connect spiritually despite all the years of trauma she experienced growing up. And through our continued conversations, I learned of her love for science and her preference for the idea of interconnectedness of the universe. And it seemed that that allowed her to remain open to mystery, wonder, and awe. So guess what? That's what we talked about. We talked about the universe. And that provided a glimpse of possibility that she needed to move forward. A few weeks later, we were able to go on a labyrinth walk at our beautiful labyrinth in front of the main hospital in Oconomowoc. And that experience allowed space for vulnerability, connection, and hope. After the walk, she said, I can do this. I really can. I can do this. Thank you. Her therapist told me the following week that consult completely changed her attitude towards treatment. She said she has hope again. This is just another example of our unique contributions and how important it is that we are partners in a concerted effort of specialists where everyone brings their expertise to the table of patient-centered care. Because this patient needed to process her spiritual struggles with a safe, competent, and compassionate spiritual caregivers. So why do I love working at Rogers? Because everyone deserves access to quality, evidence-based, holistic mental health care. We have our own motivations and reasons for being here, but we are one Rogers and part of the same mission. Our focus is our patients, and our purpose is for their holistic health and well-being. Your spiritual care department is a part of that process by guarding the sacred space for spiritual healing from the inside out. Our daily presence allows us to engage in ways that others cannot. And when we do our part of holding gently the sacred space needed for internal healing, then hope becomes real. Thank you all for supporting us and what we do. Truly, we couldn't do this without you. Thank you.